We have performed surgery on one of our patients who had a very, very massive tumor on the face, a tumor of the lower jaw. This tumor, he has been living with it, has been growing. It's been 7 years of waiting to get help. I must say that he came to us last year in October with this very big tumor that you have seen, which is a growth of the jaw. We did our planning for the surgery, which we have done today. And part of the surgical procedure for today, because of the size of the tumor, being a very big tumor on the face, we needed to be able to put him to what we call anesthesia, to put him to sleep. We needed to work as a team with ENT surgeon, also from this hospital at Meru level 5. So together with the ENT surgeon who did the first part of the surgery, where he was able to help us to bypass the mouth in order for us to be able to do what is called a tracheostomy, so that we can put the patient to sleep. That was done to give comfort also to the patient, because this was a long surgery. It has taken probably 6 hours from the time we started with the surgery up to till now. After the tracheostomy, or the tube which is usually put around the airway in the neck has been put, then the surgical team, led by myself, were able to remove the entire tumor, which we have successfully removed. The tumor itself, we have weighed it. It's about 2.5, 2.6 kilograms in weight. And this is something that we feel very proud of, this achievement of having been able to take care of the problem for this patient here in the Meru County Referral Hospital, having the facilities to do this, not just the expertise from the doctor's side. There was the nursing staff involved, there were anesthetists involved, a lot of equipment, as you can imagine, that are available here at Meru Teaching and Referral Hospital, which we have been able to use in order to remove this large tumor in the face. And we believe we have been able to touch the life of this patient and to impact positively to him. Of course, it's still the first step in our process to rehabilitate him back to normalcy. There's going to be a long healing period in this hospital, maybe for 2 weeks, where he shall be able to recover from the surgical procedure. Of course, having removed a tumor in the face, then there are concerns about how do you reconstruct the face so that he looks as normal as it were before, and how is he able to feed moving on, because this tumor involves even the teeth. And we plan again to start his rehabilitation. After he has fully healed, he will need another surgery after about 6 months. We shall do more of the reconstruction that is needed, so that we bring him back to as near normal as he was before. This kind of growth or tumor is actually one of the most commonest tumors of the jaws. It is not the most common tumors that can affect a human being, but of all the growths that happen in the jaw, this is the most common. We see a number of them in this region. The unfortunate thing about it is because it is painless, there's no real pain associated with it initially. Patients tend to live with it at home, and they only come to us when it is very, very big. So we would like to ask our people in Meru County and even beyond, when you see a growth which is unusual on your body, even if it is not painful, it is important to have it checked and to go to the specialized hospitals like the county referral hospital like this one, where you shall be able to be advised accordingly, instead of waiting 7 years as the young man in our case had waited for 7 years living with a huge tumor in the face when help was available here.
Na nimeshukuru Mungu sana kwa sababu mzee wangu leo amefanyiwa operation na amekaa sana for 7 years akipitia hiyo ugonjwa, na amekaa na hakuna kitu alikuwa akikula, alikuwa akikunywa uji peke yake, na ile ingine chakula ile ingine inakuanga softi, yeye alikuwa akikulanga na hakuna kitu kingine alikuwa akikula. Sasa saa hii mimi nimeisha kabisa, hakuna pesa niko naye, hakuna kitu niko naye, hata kitu ya kuuza niliuza mpaka ikaisha kwa nyumba. Sasa niko hivi, nilikuwa nikienda Nairobi Kenyatta Hospital, Alafu nikienda Nairobi hospital nikaona nimestruggle sana na nimepata taabu sana, na nikaona mimi siwezi kusaidika huko Nairobi. Nikafikiri kukuja Meru tena. Nikakuja Meru, nikasaidiwa na Dr. Kiremi, na nikasema asante kujumla wote kwa staff ya Meru hospital yote. Hata hivyo, hata watu wale wako na ugonjwa kama hiyo ya bwana yangu, hiyo kufura ya meno, kufura kwa meno, hiyo si shida kubwa sana, ni shida kidogo sana. Unaweza kukuja hata Meru, unaweza kutibiwa hata Meru, unaweza kufanyiwa hata operation Meru na ukakuwa sawa kabisa.